This hearing will examine the effects of the Affordable Care Act on the labor market, as well as discuss the implications of those effects on productivity, on income, and the economy at large. I want to extend a warm welcome to our committee witnesses. I appreciate you being here today. The impact of the Affordable Care Act is particularly important to discuss this year, now that the delayed employer provisions are in effect and employers are now feeling the pinch and dealing with the mandated requirements of the Act. The ACA contains numerous provisions that penalize workers and subsidize those who don't work. In fact, the Congressional Budget Office estimates that from 2017 to 2024, the law will reduce the total number of hours worked by as much as 2%. People say, well, 2%. Well, that 2% is equal to as much as 2.5 million full-time equivalent workers. Obviously, that's going to have a significant impact. Congressional Budget Office also reasoned that this would result from and I quote, the new taxes and other incentives that they will face and the financial benefits some will receive. CBO says that a 1% reduction in total labor compensation over the same time frame will likely occur. However, even those figures may underestimate the true impact of the law because those estimates don't include every relevant provision that would affect employment. For example, the employer insurance mandates will encourage employers to shift workers from full-time to part-time employment. We've seen that already. The Medicaid expansion will motivate or could motivate many low-wage full-time workers to reduce hours in order to obtain coverage. The marketplace exchange subsidies phase out abruptly as incomes rise, penalizing workers near those thresholds. And finally, the series of new taxes on individual income and health care services will reduce the incentive to work, save, and invest. Further, many of these provisions could profoundly affect businesses' abilities to expand, alter workers' hours and schedules, and reduce work flexibility for employees. New compliance costs in terms of time and resources will add significant burden to businesses. Not only does the law affect millions of businesses and their employees, but also thousands of schools and local governments. I've heard from many Indiana schools that are feeling the impact and have been forced to cut hours to make ends meet on already constrained budgets. This is hurting not only school employees, but students from elementary school through college. In an era characterized by having to do more with less, these institutions appear to be particularly affected by the undue burdens of the Affordable Care Act. Sadly, too much of the conversation has attempted to focus on the proposed benefits without taking into consideration some of the very real and significant costs and their impact, particularly on employment. That's not how a cost-benefit analysis works. It sounds more like a benefits-only analysis. In addition to these economic burdens, we now know that many of the goals of the Affordable Care Act have not been met. Emergency room visits continue to rise. Healthcare costs in terms of premiums, co-payments, and deductibles continue to rise, some dramatically. Many seem to be saying that they're happy to hear that more people are covered, but it's less affordable for us. CBO estimates that premiums will rise an average of 8.5% annually over the next 3 years as temporary government programs intended to reduce insurer costs are phased out. In most states, insurers with large market shares have proposed rate increases exceeding 20% for the next year. Obamacare is about to become much more expensive than it's been advertised. While this law may have provided affordable access to health care for some, it has seriously hindered others. Many lost their employer-provided insurance and were displaced to the exchanges and Medicaid. Many lost the ability to keep their plans and their doctors. New taxes built into the law still to be implemented will have additional negative effects on businesses and its workers. I think I can speak for many of us, if not all of us here, in saying that we'd like everybody to be insured and receive quality health care when they need it. However, the policy in the books isn't the solution. Instead, it has led to more unintended problems. A one-size-fits-all government-run health care system, in my opinion, is not the answer. We're looking for the best workable, real-world solution for Americans, and I don't believe we've hit that mark just yet. We should pursue initiatives that truly make health care an option for all. Such initiatives should drive down costs by increasing competition and transparency, reforming medical malpractice, making health insurance portable, promoting pooling options for small businesses, and giving states greater flexibility in delivering health services. Americans deserve a better health care system that puts individuals squarely in charge of their health care and doesn't discourage Americans from working and improving their earnings.